Dr. Christoph Correll, thank you and welcome to the Valder Beebe Show live from Dallas, Texas. I want my audience to know that Dr. Correll here, he's here to discuss the day-to-day realities of adults who live with schizophrenia and more. And living with schizophrenia is not what most of us think. Recovery is possible. Dr. Correll, that is a great tagline, recovery is possible. Could we talk about, first of all, what is schizophrenia and then living with the day-to-day realities?
Absolutely. I think there are lots of misconceptions, as you mentioned. Many people think schizophrenia means multiple personality. That's not the case. It means that there's a split in the mental operations that are common to us and feel like normal, but they can get out of control in people with schizophrenia. So it affects really the way people think, act, feel, perceive the world, and integrate those stimuli, talk, and behave toward others. And that can make it very hard for them to function. They can maybe have a delusion that they are being pursued by others, they're prosecuted. There could also be voices that they hear in their mind. And I'm quite excited to be partnering with Janssen Pharmaceuticals to educate about schizophrenia on this show and also about new treatment options that include long-acting treatments.
Tell me the importance of understanding that living with schizophrenia help us understand that people who have this disorder can live an independent and a productive life with the right treatment plan.
Yes, I think that's important to recognize, and everybody who listens and has maybe a loved one with schizophrenia to not just go by what's out in the media, the portrayal of this is a fate and you can't live a life independently or go to school or have a relationship. This is possible, but it's only possible when the right treatments are given. That includes talk therapy to deal with the voices and how one is sick. It talks also about the treatment with family members. We know that family therapy and social support is important. Self-care needs to be trained, but medication is the name of the game. And that is starting with oral medication given every day, but that's hard for all of us to actually stomach and do every day. And people with schizophrenia have an even harder time, so that they may have lapses and then relapse into the illness. And here, a long-acting injectable treatment can be very helpful because it makes non-adherence visible and also much less likely, so that there is a delay in the next crisis or hospitalization. People can actually live longer and can achieve functionality, which means having friends again, going out of the house, being able to start training and go to school, even though it might be harder than before, and also keeping a job, depending on what is suitable for them. That needs to be figured out with the treatment team, but also maybe living independently again and having some small income. This is possible with the right treatment.
This treatment is called LAI treatment, and it seems to have options. Tell me, adult patients living with schizophrenia, they become self-medicators once they're treated? How does that work?
Yeah, that's a great question. So basically, when we prescribe an oral medication, they are self-medicators, but they often don't self-medicate. Even when we give it to them, they might hide that they're not taking it. Now, a long-acting injectable medication is given by a healthcare professional. Don't be scared. It's not in the hospital always. You can have that also out in the community, in the convenience of the office of your doctor or with a nurse. In some states, it can even be given at a pharmacy. And there are different options that have different injection intervals. And we've learned that the longer the interval, the better. So, for example, there's Invega Sustenna. That's once a month, 12 treatments a year. There's Invega Trinza every 3 months. That's 4 times a year. And there's Invega Half-Yeara, which is every 6 months, which is the only 6-monthly treatment available in the US and the world. And a recent open label study suggested that nearly 96% of patients were relapse-free for 2 years. And nearly 90% actually finished the full 2-year course, voting with their feet that this was a good option for them. But like with all medications, there are risks and benefits, and people should talk about these treatment options with their doctor about what are the options for this particular patient. and whether or not information is necessary, which can be given by the doctor, but also from a very nice website that I recommend to my patients and families. That's Janssen, JANSSENLAIS for longactinginjectables.com.
Dr. Correll, this is off script, but are we at a precipice of dealing with or solving some medical problems? Every day I talk to medical professionals like you who come forth with at least a treatment, things I've never heard of having a viable treatment before. So has technology taken us to this place?
So I think technology is part of it, because you need to formulate the medication in a way that is safely entering the body, staying there, and being released continuously. And we've made very big strides in making it possible. Before, it started with 2 weekly injections, then it was monthly. And Janssen has the only 3 monthly and 6 monthly options, which have to do with technology. I agree. But any technology can be as good as it is. If it's not prescribed and taken, it will not help. So we should ask our healthcare professional about this option and see whether it's the right thing for this individual patient.
And once again, where do they go online and find out more about this treatment option?
It's JanssenLAIS.com, JANSENLAIS.com, which really has valuable information.
Dr. Correll, this has been so interesting and eye-opening. Thank you for stopping by the Valder Beebe Show. It has been totally my pleasure.
The pleasure has been all mine. Thank you so much.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.